WCCO4 News has learned that a nurse with a history of narcotics theft illegally accessed a state database that has prescription drug records for 1 million Minnesotans.
Our investigation found that despite the nurse's background, he was given access to the database by both the Minnesota Department of Human Services and the state's largest insurer, Blue Cross Blue Shield. Tonight, there are major questions about how state officials and Blue Cross handled this breach. Here's WCCO's Esme Murphy.
Our story begins with a state database that has the names, addresses, and prescription records for 1 million Minnesotans. It was set up in 2010 to monitor the abuse of prescription drugs. It's administered by the State Board of Pharmacy. Cody Weiberg is the board's executive director.
Usually when people are addicted to medications, they go to multiple prescribers in a short period of time.
Access to the database is mostly limited to physicians and pharmacists, but 2 Blue Cross Blue Shield of Minnesota employees are granted access. That's because the state pays Blue Cross to monitor drugs in state-run medical programs. In 2010, one of the employees the state of Minnesota and Blue Cross allowed to access the database was registered nurse Jim Johnston. Johnston's access was supposed to end in March of 2012 when Blue Cross assigned another employee to the job. The state failed to take Johnston off the list of legal users. 8 months later, an audit found Johnston had gone into the database 249 times when he shouldn't have. He looked up 56 individual patients' records, meaning he accessed some people more than once. Was the accessing of this data a violation of federal law, HIPAA, and also state law?
Yes, it's very clear under state law and federal law to HIPAA that you can only access data when you have a need to access the data.
A state investigation also found that Johnston accessed patients' personal social media accounts and in one case shared a patient's picture with other Blue Cross employees over a company messaging system. Jim Johnston and Blue Cross Blue Shield refused repeated requests for interviews, so we don't know why Johnston accessed the private information and what, if anything, he did with it. What we do know is that he has a documented record of stealing and abusing narcotics, a record the Minnesota Department of Human Services and the State Board of Pharmacy told us they did not know about until we told them. Johnston was never criminally charged, but his discipline records are easy to find on the State Board of Nursing's website. In 2000, he admitted to stealing narcotics meant for critically ill infants at Children's Hospital in St. Paul and was fired. In 2002, he was fired from Unity Hospital in Fridley after testing positive and admitting to stealing morphine. Johnston never lost his nursing license. He was fined and required extra supervision for a time. His LinkedIn page says 3 months after being fired from Unity, he began working for Blue Cross Blue Shield. It is not a violation of state law for someone with a history of drug theft to have access to the state prescription database. But Brian Krallis, a Dallas-based healthcare consultant, says it raises serious questions under federal health privacy laws.
The act that they actually took somebody with a known history, a known past record, and put this person in charge of these documents, in charge of this arena, and had access to this information is what they actually call willful neglect.
Jim Johnston told investigators that he told a Blue Cross supervisor in 2012 that he still had access to the database and that the supervisor did not tell him to stop. We asked Blue Cross about that. They did not respond. Hamlin Law professor David Schultz.
That's a major problem because at that point, Blue Cross can't say that it did not know that there was a violation.
Brian Krallis and the Board of Pharmacy says the accessing of each of the 56 individual patients' records were illegal, and Blue Cross could be subject to major federal government fines.
He purposely went in to review patient information. And anytime that happens, that individual, whoever it is, has a right to know that their individual information was compromised.
But DHS says only 16 of the patients' records were accessed illegally. Their reasoning? While Jim Johnston didn't have legal access to the database, 2 others at Blue Cross did. Professor Schultz says DHS got it wrong.
It doesn't make any sense. If he's illegally accessing it, he's illegally accessing it, and it doesn't matter whether or not the Blue Cross had legal access to the rest of them.
When we went to DHS for answers, they gave us an interpretation of federal HIPAA law that 3 experts say is wrong. And remember, DHS manages healthcare programs for 1 million Minnesotans. The agency told us there was no need to report any of this breach to federal authorities because the reporting requirement is for breaches of 500 individuals or more. Page 60 of the HIPAA regulations says breaches of less than 500 patients have to be reported annually.
They just got that wrong. And I wonder, for how many years have they been operating with that incorrect interpretation where they're being where they're basically federal law saying you must report and they're not reporting.
Minnesota taxpayers pay Blue Cross $500 million for managed health care programs.
I would have some serious misgivings about giving money, especially taxpayer dollars, to an entity that does not appear like it's even following the simplest of rules and regulations.
After investigating the breach, the Board of Nursing disciplined Johnston, ordering him to undergo HIPAA training and fined him $5,000. Johnston no longer has access to the drug database. And while Blue Cross suspended Johnston in March of 2013, he was later reinstated and continues to work there as an access management specialist, a fact that Brian Krallis can't believe.
Access that even still has a job, I really am at a loss. I don't even know what to say.
By email, Blue Cross told us the breach is an isolated situation and no personal information was shared with anyone outside the company. The Federal Department of Human Services would not comment.